This is my client Daniel, who wears many hats. One of them is that he's a personal trainer and was very active in athletics throughout his life. And this is the end of his second visit, and we've been working on reducing a torsional pattern throughout his pelvis and hips. And we have symmetry of position on both sides, little subtle asymmetry on the lower pelvis, and I think that's what I call a factory defect. His pelvis developed a little bit asymmetrical. I'm more focused on mobility side to side, and he had blocked motion on both sides in opposite directions, and we've improved that mobility, which is measured with passive movement. For example, this is a stress test to the sacrum, and I can load the sacrum on the lower portion, and I can then spring it and it recoils, and I can see movement go down the lower extremities. So the force is going into the SI joint and down through the bony pelvis into the hip and down into the legs. Would you describe how you injured your low back, and could you describe your symptoms in your low back?
Lifting overhead and feeling a disc slip or move right there at the sacrum.
And how much weight was that?
A couple hundred, 225 or something.
Yeah, so that was considerable. And of course, force times distance is torque, right?
Correct.
Yeah, it's more than just the weight itself.
Yep.
And I'm not going to defend the term slip disc. It's
Knuckling of the, it moved.
Something moved.
That's what I say. It moved.
Something moved. Yes, yeah, indeed. So what I found after, essentially balancing the pelvis side to side, what I found is that with the spring test on the lower sacrum, I can load it, and I see his feet move a little bit when I do that, and then I can spring and I feel a bounce. I feel a give and a bounce. When I do the same test, this is S2 because this is the PSISs, and so upper sacrum is right here. And what I find is that I cannot take up the slack using a reasonable amount of force, and therefore I can't spring it. And when I come up to L5, we find the same thing. L5 doesn't allow me to load it. It doesn't allow me to spring it forward. And then when I come up to L4, I perceive motion there. And earlier you were a little more tender at 4, right?
Yep.
Okay. So what I call this, the nomenclature, right or wrong, is a forward bent sacrum. And so my goal, sorry, that would be a backward bent sacrum. Yeah, backward bent sacrum. So this reduces his extension, and in fact he's uncomfortable in prone lying. He's more aware of this part of his low back. And so what I want to do is increase forward bending of the sacrum, which would increase anterior glide of L5. Before we stop filming, can you do a push press up? Keep the pelvis down, and then just use your arms and lift up your upper body. And what does that feel like?
I don't feel too much there.
Okay, so you don't feel a tightness there? Okay. Alrighty. Well, my goal is to restore anterior glide of L5 by improving forward bending of the sacrum. And so the way that I'm going to accomplish that is I'm going to load the sacrum at S1 at the upper part of the sacrum and just lean on it like this gently. And I'm going to do that for 5 minutes. It will be very gentle. I will have him in passive extension, so I will put 2 pillows under his chest. And so we'll do this now, and then I'll come back and film in a couple of minutes when I'm finished and see what we accomplish. It's not something I see very often, and that's why I'm filming this and posting it.
Okay.
So we'll stop filming now.